I'm Rémy Choquet. I'm the actual innovation director at Orange Healthcare, and my interest, because I was also a researcher in e-health, is data as a subject of research. My presentation was about presenting the problematic of rare diseases in the light of what kind of data do we need to actually help clinicians and researchers to understand rare disease, the rare disease of a patient. And the presentation was highlighting the fact that to understand the rare disease of a patient, we need many data that come from various sources, which could be phenotypic data from clinics, could be molecular biological data for genetics, and also in some cases exposomics data from the exposition of the patient to its environment, to actually try to understand why patients have rare diseases and why sometimes it's still difficult to understand that even if the genetic mutation has been found, in some cases the phenotypic expression of this mutation is not the same from a patient to the other. So in the rare disease problematic as a whole, which is when we talk about rare disease, we talk about 7,000 known diseases or states. There is still a big problematic about first the diagnosis delay, access to the diagnosis, and the second problematic is about the patient that still are taking in charge into a specific center, as in France. There is still some about 50%, depending on the center of patient, that will not have a diagnosis, a molecular biological diagnosis known, and which tells us that we still need to go further in the comprehension of the rare diseases. So applied to rare disease, we have to make sure that we understand that research, for example, is required to actually make a diagnosis. So we are in a continuum between research and care, and so what is important is that we make sure that we can build databases where we can do observational studies through the lifetime of a patient, sometimes when we don't understand the disease or we don't understand the natural history of the disease. So the big problematic is that and because a patient will be seen in many hospitals in France and sometimes even at European level from some specificities of this disease, because we are in a very, very narrow expertise field, we need to make sure that all these data could be interconnected together. So in terms of big data, we are not talking about volumes, we are talking about heterogeneity and velocity of the data. So we need to make sure that for rare disease and for research and care to happen in a much efficient way, I would say, we have to make sure that we actually are in a position to link data for patients and that we can put them together at some point and reason on it together and to better understand what's happening for this patient. So it's an interoperability problem, but this is something that is very, very difficult to resolve at the moment.